The number of push-ups completed will reflect upper body muscular strength and endurance. For both men and women, the primary goal for the push-up assessment is to perform as many push-ups as possible without rest. It is important to maintain proper breathing. Exhale with effort when pushing away from the floor. For men, the push-up test starts off with the standard down position. This includes hands pointing forward, under the shoulder, back straight, and head up, using the toes as a pivotal point. For women, the modified knee push-up position is often used with legs together, lower leg in contact with mat, ankles plantar flex, back straight, hands shoulder width apart, and head up, using the knees as a pivotal point. Both the standard and modified push-up can be used for men and women. Both men and women should keep their back straight at all times and must push up to a straight arm position. The maximal number of push-ups performed consecutively without rest is counted as a score. The push-up test stops when one strains forcibly or is unable to maintain the appropriate exercise technique within 2 repetitions. Warm-up activities increase the muscle's temperature and localize blood flow and promotes appropriate cardiovascular responses to exercise. The 1 repetition maximum strength assessment is the heaviest weight lifted successfully through the full range of motion with proper technique. The procedure for the 1RM test is as follows. Engage in a 5 to 10 minute low intensity aerobic warm-up, then perform several reps with a light load. Afterwards, select an initial weight that is within one's perceived capacity, specifically between 50 to 70% capacity. Attempt the 1RM lift. If successful, rest 3 to 5 minutes before the next trial. Increase the weight by 2.5 to 20 kilograms until subject cannot complete the lift. A 1RM should be obtained within 4 sets to avoid excessive exhaustion. A traditional bench press should be utilized for the 1RM test, but due to it being readily available, a bench press Smith machine was used instead. Strength to weight ratio is simply the amount of weight one is able to lift divided by body weight. Keep in mind that strength to weight ratio is higher for a trained lifter who has trained for years versus a novice lifter with a lower strength to weight ratio who has trained for only a few months. The reps to fatigue protocol is ideal for sedentary, adolescent, and older populations, allowing for 2 to 10 repetitions at about 75% of a maximal load. A maximal protocol involves lifting heavy weight for 1 repetition. Using a maximal test raises concern due to the amount of stress on the muscles, bones, and connective tissue, as well as raising one's blood pressure. Maximal tests also require highly specialized technique. A submaximal protocol is the ability to perform successive repetitions with heavy near maximal weight for a short period of time. Submaximal tests are much safer than maximal tests.